Strategies for improving sleep quality. Addressing sleep disorders, and creating a sleep-conducive environment. Sleep deprivation studies confirm the relationship between inadequate sleep and a wide range of disorders, such as high blood pressure, obesity or overweight and type 2 diabetes, cardiovascular disease, impaired immune functioning, and more. Sleep is essential for our physical and mental health. It allows our bodies to rest and repair themselves, and it helps us consolidate memories and learn new information. Unfortunately, many people have trouble sleeping, especially as they age. According to the Centers for Disease Control and Prevention, CDC, 1 in 3 adults in the United States does not get enough sleep on a regular basis. There are many reasons why people may have trouble sleeping. Some common causes include stress, anxiety, depression, medical conditions, and medications. Need to mention watching stressful movies or TV shows just before bedtime. However, there are also many things that people can do to improve their sleep quality. Strategies for improving sleep quality. Circadian rhythm is mainly sleep during dark hours of the day. Subscribe for a new video on how to sleep if you're on shift work. It may be hard for a person working on shift work. Establish a regular sleep schedule, which synchronizes with circadian rhythm. Go to bed and wake up at the same time each day, even on weekends. This will help to regulate your body's natural sleep-wake cycle. Create a relaxing bedtime routine. This could include taking a warm bath, reading a book, or listening to calming music. Avoid watching TV or using electronic devices in the hour before bed, as the blue light emitted from these devices can interfere with sleep. Make sure your bedroom is dark, quiet, and cool. Darkness helps to promote the production of melatonin, a hormone that regulates sleep. Noise and light can disrupt sleep, so make sure your bedroom is as dark and quiet as possible. A cool temperature is also ideal for sleep. Avoid caffeine and alcohol before bed. Caffeine and alcohol can interfere with sleep, so it is best to avoid them in the hours leading up to bedtime. Get regular exercise, but not too close to bedtime. Exercise can help to improve sleep quality, but it is important to avoid exercising too close to bedtime, as this can make it difficult to fall asleep. Addressing sleep disorders. If you have trouble sleeping despite following good sleep hygiene habits, you may have a sleep disorder. Some common sleep disorders include insomnia, sleep apnea, and restless leg syndrome. If you suspect that you may have a sleep disorder, talk to your doctor or healthcare professional. Insomnia is a sleep disorder that is characterized by difficulty falling and or staying asleep. There are many different types of insomnia, and the best treatment will vary depending on the underlying cause. Common treatments for insomnia include cognitive behavioral therapy, CBT, and medication. Sleep apnea is a sleep disorder that is characterized by pauses in breathing during sleep. These pauses can last for a few seconds or a few minutes, and they can occur multiple times during the night. Sleep apnea can lead to a number of health problems, including heart disease, stroke, and type 2 diabetes. Treatment for sleep apnea typically involves using a continuous positive airway pressure, CPAP, machine. Restless leg syndrome, RLS, is a sleep disorder that is characterized by an irresistible urge to move the legs. This urge is usually most intense in the evening and at night. RLS can make it difficult to fall asleep and stay asleep. Treatment for RLS typically involves medication. Creating a sleep-conducive environment. Your bedroom environment can have a big impact on your sleep quality. Here are some tips for creating a sleep-conducive environment. Make sure your bed is comfortable. Invest in a good mattress and pillows. Your bed should be large enough for you to move around comfortably. Keep your bedroom dark, quiet, and cool. Use blackout curtains or a sleep mask to block out light. Use a fan or white noise machine to drown out noise. Set the thermostat to a comfortable temperature. Remove distractions from your bedroom. This includes TVs, computers, and smartphones. Make sure your bedroom is well ventilated. Fresh air can help you sleep better. Avoid napping during the day. Long or frequent naps can make it difficult to fall asleep at night. If you have trouble sleeping, there are many things you can do to improve your sleep quality. By following the tips above, you can create a sleep-conducive environment and address any underlying sleep disorders. Additional tips for improving sleep quality. Eat a healthy diet. Avoid eating heavy meals or sugary snacks before bed. Get regular exercise, but not too close to bedtime. Avoid caffeine-containing food and drinks like coffee and alcohol before bed. Establish a regular sleep schedule and stick to it as much as possible, even on weekends. Create a relaxing bedtime routine. Make sure your bedroom is dark, quiet, and cool and no electronic, mobiles, TV, etc. Remove distractions from your bedroom. Get regular sunlight exposure during the day. See a doctor if you have chronic trouble sleeping. Final words. Sleep is essential for our physical and mental health. By following the tips above, you can improve your sleep quality and create a sleep-conducive environment. If you have chronic trouble sleeping, talk to your doctor to rule out any underlying medical conditions. Think, your health is very important for your family as well. Do not forget to click the like button. Thanks very much for watching this video. Up above you see 2 videos related to health. It will be more helpful to you and your family. See you in the next video.